How to follow up on abnormal cervical screening. When you receive abnormal results from a cervical screening test, such as a Pap test or human papillomavirus test, it can be concerning. However, most abnormal results do not mean you have cancer. They indicate a need for further evaluation to assess the risk of cervical precancer or cancer. It is crucial to follow up carefully and understand the next steps. The follow-up process is personalized based on your specific situation. Your healthcare provider will consider your test results, previous screenings, and individual risk factors, including your age. Current guidelines suggest a risk-based management approach rather than a one-size-fits-all method. The first step is a risk assessment. Your healthcare provider will evaluate your current test results alongside your health history to estimate your risk of significant cervical cell changes. For minor abnormalities or low-risk cases, your provider may recommend repeat testing. This could involve a follow-up Pap test or human papillomavirus testing in 1 year or 3 years. This approach helps monitor any changes without unnecessary invasive procedures. If your risk is higher, your provider may suggest a colposcopy. This is a detailed examination of the cervix using a special microscope. During this procedure, biopsies may be taken from any abnormal areas. These biopsies help determine the severity of any cell changes. If high-grade precancerous changes are found, such as cervical intraepithelial neoplasia grade 2 or 3, treatment is usually recommended. This treatment aims to remove or destroy the abnormal cells to prevent progression to cervical cancer. After treatment, close follow-up is essential. Your healthcare provider will likely recommend HPV testing or co-testing at intervals such as 6, 18, and 30 months. Long-term surveillance is advised for at least 25 years, as the risk of recurrence or new lesions remains elevated. For patients with low-risk findings and negative follow-up tests, it is possible to return to routine screening intervals. Typically, this means Pap tests every 3 years or human papillomavirus testing every 5 years. It is important to remember that follow-up recommendations are based on expert consensus guidelines. These guidelines aim to balance the need for early detection and treatment of serious abnormalities while avoiding overtreatment of minor changes. If you have difficulty adhering to follow-up appointments, your healthcare provider may offer colposcopy and biopsy services directly to improve care linkage. Pregnant patients or those with unique circumstances may have modified follow-up plans. Always follow your healthcare provider's recommendations closely and attend all follow-up appointments. In summary, following up on abnormal cervical screening involves a personalized plan of repeat testing, diagnostic procedures, and possible treatment based on risk assessment. This approach helps effectively detect and manage precancerous changes while minimizing unnecessary interventions. Always consult your healthcare provider for individualized advice and care.